previous studies had focused on, single center or multi-center studies. And since stroke is a rare event, even though there is a higher risk during pregnancy and postpartum period, but it's still a rare event. So unless you have enough women who are pregnant being studied together, you just don't have the necessary statistical power or the design advantage to really come up with a conclusive answer to a question. So in that sense, since this study included over 220,000 pregnancies, so it does actually have a much larger group of pregnant women to allow to answer this question in a conclusive way. So I think that, there's clearly an advantage of this particular study in that sense. And I think, the biggest message here is awareness and recognition. And I think that, without appropriate data, there has always been a sense, but, it doesn't have the necessary backing of objective data to, support that conclusion. And now I think is how do you translate it to an action plan? So obviously there is certain things to do from a care pathway. We talked about the multidisciplinary team. We talked about how to include this particular aspect of history into the high-risk pregnancy, and perhaps actually having specialized centers manage such a pregnancy. And obviously there is certain research questions that emerge too, that perhaps there are certain medication during pregnancy that can reduce or mitigate that risk. And new studies should actually evaluate the role of such medication. The lack of awareness is on both sides. So it's the lack of awareness among young people, but there's also a lack of awareness in medical professionals as well. So it's a bidirectional lack of awareness.